I'm Dr. Deirdre Guthrie, and I work at the Wellbeing at Work project for the University of Notre Dame. And I'm leading the aspect of the research on global healthcare workers, which is part of our larger project on humanitarian workers. We're particularly interested in this group of people because they're often called to this work. In the case of Compañeros en Salud, this Mexican affiliate of Partners in Health, the young medical practitioners called pasantes who are doing their service year in the remote Sierra Madre Mountains amongst the coffee plantation communities, they're very invested in the social justice aspects of the work. So their identification with the work is what makes a kind of higher stakes game when it comes to well-being. Once these pasantes complete their medical internship, they start their service year in these communities, and it's in about the third month where they face what they call la enormidad, or this wall of limitation, this enormity of need that they realize that they're up against. And that has to do with the structure of the medical healthcare system in Mexico, which doesn't serve the poor. It can be about non-compliance with treatment, but at some point their ideals get tested. And how they navigate this period is what we're particularly interested in terms of their well-being. During our interviews and our daily life studies, what comes up is that some pasantes have been mentored or have strong social networks of support, and so they're able to navigate this period with a little bit more skill or capacity than others. But we present some suggestions, recommendations for how others can create a backstage, what we call a backstage, which is an area where they can make mistakes, be vulnerable, reflect upon their experience. The interview and the diary method itself is an opportunity to do this kind of reflection. And others have contemplative practices in their repertoire that they can draw from, so everything from playing classical music, like the cello, or playing music during consults, going kayaking in the rivers during their free days, or praying to their higher power. All of these practices end up being critical to sustain pasantes as they navigate through this experience of their service year. Another finding is that those who really flourish in this work learn how to practice accompaniment. Accompaniment is an idea from liberation theology that means walking with another person. And so in this context, it means doctors walking with community people. And whether that's community healthcare workers who they train to help them diagnose and keep the community participating in their healthcare, or making tamales with local women who spend a lot of time feeding the pasantes every day, or playing basketball with the local kids. Those who really learn how to walk with others in the field really flourish in this work. I've traveled to Chiapas for about 6 trips last year, and each trip was sort of built on the last in terms of strengthening the trust relationships with members of the organization. And we're very excited that now we have a lot of investment in the organization, and the organization is very much excited to be working with us. We're continuing to design ways that members of the organization can strengthen their backstage spaces and help support their pasantes in this very challenging work that they do, very important work. And we're excited about the potential for the future.